What does it mean when your doctor tells you you have essential hypertension? Basically, we get a diagnosis of essential hypertension when it's not directly possible to attribute the experience of hypertension or the diagnosis of hypertension to a specific cause. But that doesn't mean it's not possible to identify the root cause if there's proper examination of the patient physically and by interrogating one's lifestyle and diet. With the advances we have in functional medicine, now we are able to sit down with a client or a patient, go through their lifestyle and diet, take their measurements, and close to accurately tell why they have hypertension. Once we are able to identify these root causes and address them, by giving the patient the knowledge, teaching them the skills, correcting their diet, it's possible to modify the experience of essential hypertension. And by that I mean reducing the measurements, reducing the dependence on medications, reducing side effects that we may get from medications, doing away with the nutrient depletions that are associated with some of these medications, and last but not least, protecting our organs from the damage long-term hypertension causes. I'll mention the common lifestyle and diet related root causes of essential hypertension. My list is not exhaustive, but these are the major ones that we encounter in our practice. Insulin resistance is top on the list. Insulin is a hormone we produce when we had meals. It's normal to have insulin, so it's a normal hormone in the body. It helps us to store away energy from food in form of fat and glycogen. We have normal or acceptable amounts of insulin, but we also have unacceptable amounts of insulin that are associated with the kind of damages we see in a number of chronic diseases. We get excessively high amounts of insulin in our body when we are constantly eating, when we eat a lot of refined carbohydrates, when we don't pay attention to the proportions of carbohydrates, proteins, and fat in our diet, and in some more complex cases when we do not have proper sleep habits. How insulin damages your arteries and eventually causing hypertension is that it alters the nature of the inner lining of blood vessels. And when this alteration has occurred, the body will try to do repairs that bring in other materials that end up thickening the blood vessels and making them stiff. And so you get a plaque forming on the inner side of the arteries at different places in the body. And this plaque is called an atheroma. What an atheroma does is that it will stiffen your blood vessels from small to large in all organs, and it will also reduce the size of the lumen of the blood vessels. And so when you have stiffening combined with a reduction in the lumen size, your blood pressure will automatically go up. Is it possible to control our insulin levels? Certainly yes. And in the subsequent talks, I will address that. Uric acid would be the second commonest reason why we get stiff arteries. Uric acid also, just like insulin, is a normal it's a normal agent we have in our bodies. And so we have normal amounts and amounts that are not so normal. It's a byproduct from certain foods. The main foods would be sugar, fruits, fruit juices, alcohol, red meat, organ meats, some forms of fish, and a few other foods. But these would be the main sources of uric acid. Uric acid alters the behavior of the inner lining of blood vessels. And what we get when you have excessively high levels of uric acid is that nitric oxide, a gas that's meant to help our vessels relax, will usually reduce in size. And so when our vessels are not as flexible as they should be, we get stiffening. And of course, stiff arteries are not flexible enough to allow easy flow of blood, and so you end up with hypertension. Inflammation is also a major one, and it tends to be almost associated with everything else I'll talk about. There are various sources of inflammation in the body, and inflammation for brief periods is a protective mechanism. But when we have inflammation going on chronically, it creates several problems in the organs of the body, and of course blood vessels included. The main reason why we may get inflammation in our body that's related to diet and lifestyle is the excessive consumption of omega-6 oils. And this comes in two forms. When we consume red meat, chicken, eggs, and dairy in excessive amounts, we get high levels of omega-6 oil. When we consume very low amounts of omega-3 oil, and omega-3, the main source of omega-3 would be fatty fish, but you can also get omega-3 from grass-fed poultry and beef. When we have an imbalance that entails very high levels of omega-6 and very low levels of omega-3, there are certain products of inflammation that the body makes, and these byproducts of inflammation are very irritating to organs and blood vessels, and so they cause physical injury. And whenever we have physical injury to the body's repair mechanisms will kick in, and they do so by forming atheromas, just like in previous cases. So that you'll have cholesterol harnessed or brought to the areas of injury. It will do the patchwork, but unfortunately it also ends up being hardened when minerals come in, and so you end up with hard plaques that make the arteries stiff and reduce the lumen size that should permit healthy blood flow. Toxins from our food and drink, tobacco, pollutants from our environment, all those agents may cause inflammation. And then chronic infections that are not well managed may also cause inflammation. Another major cause of hypertension is micronutrient deficiencies. Micronutrient deficiencies are easily missed because they do not cause very severe disease. You're not likely to end up in a hospital bed because of micronutrient deficiencies. And so if you don't have a very good wellness checkup, they're easy to miss. But when you get a comprehensive wellness checkup and somebody is able to check your hair, your nails, your skin, your mouth, your eyes, it's possible to identify some of these micronutrient deficiencies, but they can also checked in the lab. The major ones associated with hypertension would be vitamin B complex, magnesium, vitamin D, zinc, coenzyme Q10, and so forth. These micronutrients are used at different levels to make sure we have general good health and a healthy BP. One of the main organs that requires a high amount of micronutrients is the brain. The brain requires these micronutrients and it uses them as fuel to produce energy. When they're lacking in part or whole, it malfunctions, and so you get impaired blood pressure control. Sorry about that. Then we have B complex, especially B1, B3, B6. These are involved in a certain process called methylation, where they help convert homocysteine to glutathione. Glutathione is an antioxidant in the body. When you have insufficient B vitamins, we don't get that necessary or requisite conversion, and so you get a buildup of homocysteine. Homocysteine in high levels is a toxin, and it will make you get hypertension. It increases the resistance in the peripheries away from the heart, and so you get stiffening of muscles and tissues around the blood vessels, and so the blood is not able to flow as it should. We also get a buildup of homocysteine in people who stressed a lot, especially as seen in the cases of excessive strain or excessive intense physical activity. They tend to deplete their B vitamins and end up with high homocysteine levels, which resists blood flow. Vitamin D is very important. It plays a critical role in the kidney to control our hypertension, and so we need to pay attention to that, especially because even in sunny areas, people still suffer vitamin D deficiencies. Then we have stress and sleep. Lack of sleep or poor sleep habits are stressful to the body. And so just like other sources of stress, such as psychosocial stress, stress because of injuries, stress because of disease, this is interpreted as stress by the brain, and what it does is that it increases the demand on your micronutrients, and if you don't supplement this extra requirement, you end up with shortfalls that cause deficiencies, and so the brain will not be able to carry its functions, many functions, and BP control being just one of them. And then we have sedentarism. Sedentarism, when you're not physically active, when maybe your job involves a lot of sitting, or you just don't move a lot, you tend not to exercise your heart. Your heart is a muscle and it requires exercise to function well. And exercise has many other benefits that eventually tie in together to control your BP. It will improve your insulin sensitivity. It will improve your excretion of toxins. It will help you relax. And so when we are sedentary, we lose on these benefits, and we are likely to have hypertension. I'm done for now. In the subsequent discussions, I will address these same root causes and help you understand how you can improve on them so that you reduce your hypertension and basically enjoy good health. Goodbye for now.